special interview, I spoke to Dr. Ankit Bharat, the Chief of Thoracic Surgery of Northwestern Medicine of Chicago, the Indian origin surgeon who conducted the first lung transplant of a COVID patient in the US. The lungs of the patient, who was just in her 20s, were damaged due to the contraction of severe COVID infection. She was on a ventilator and heart and lung machine for almost 2 months before her operation. So Dr. Bharat, first tell us about this particular case.
Yeah, Gargi, so this was a very young woman. She's in her 20s, and she got this virus actually sitting at home. She has a significant other who was doing all the household work, but she was primarily staying at home. She had a very minor medical illness that possibly increased her risk of getting this virus. So she was, as I said, staying at home. And then she got this virus, and very quickly after that, she needed to be placed on the ventilator, and that wasn't sufficient. She quickly, got worse to the point that we had to place her on something called ECMO, which is a heart and lung support device, and then we, treated her with all the standard treatments, that are currently available, with including the remdesivir and some of the other drugs that are in the clinical trials. But she continued to get worse. Her lungs got permanently damaged, and she started to develop these big cavities inside the lungs, which then got infected by other types of bacteria. So she got quite sick. And ultimately, at about 6 weeks, she, got one complication after the other from the virus. So we had no other hope for her outside of lung transplant. So, given how young she was and how functional she was at baseline prior to all this starting, we wanted to give her every chance to get out of this. So we considered the transplant for her.
Right. Doctor, also tell us, how challenging was it? It's a very long surgery over several hours, and also the fact that the patient is COVID positive. So that in itself is something that's a bit of a challenge.
Yeah, Gargi, so what happened was, ever since we first saw cases with this virus, we were actually anticipating that we are going to have, a situation similar to this. When you have a virus like this, which is destroying your lungs, we knew that there'll be a situation where the patients would not be able to come off the ventilator. So we had done a lot of thinking how to get these patients through. In fact, we have a study ongoing in which some of the patients who expired at our center, we would perform autopsy to understand what the anatomy inside the chest looks like, how badly the lungs are damaged. So we had studied this quite a bit to prepare us for something like this. And we had, worked with our team. Our transplant program takes very challenging cases routinely. So we had, thought through this. How are we going to manage these patients? What immunosuppressive medications we're going to give? What are inside the operating room? How are we going to handle these, the technical challenges?
Right. It's also a credit to the U.S. Organ donation program that you were able to get a donor, a lung donor, fairly quickly. In India, we also have an organ donation program, but it needs to be a lot better.
That's a very good point, Gargi. I think it's so important for people to be open to organ donation, and we in the United States are very fortunate to have a really great system, and a lot of people in the community have already signed up to be organ donors. These lungs obviously need to come from individuals who died. They've had a brain death, or they've have had a cardiac death and so forth. So that's a very, very important point. And I wish more people are open to organ donation. It saves lives.
And finally, doctor, do you think that a lung transplant for a COVID patient will be a rarity and only in very, very extreme situations, or do you expect to see a lot more of these type of transplants?
Everybody is going to be a transplant candidate, but as we've talked to other centers, we've realized that there are a number of people in the exact same situation. So that's one aspect of it, and there is a lot of, discussions right now in the U.S. and international communities to understand how to fit in lung transplant in the care of these patients. So I would say, in patients who are, otherwise young, healthy, with limited, other comorbid conditions, and they cannot, come off the ventilator, and they've cleared the virus, over many weeks, this could be a life-saving intervention. The other thing I would tell you is, at our center, of all the patients who go on the ventilator, about 15% or about that number end up actually dying, which is actually a pretty good number compared to some of the publications that have come out showing about 80 to 90, almost 80% mortality. So, but even the patients who survive, right? So patients who come off the ventilator, a number of them go home on a lot of oxygen, and they are quite deconditioned. Their lungs have taken a major hit. So we are closely following those patients to understand what's going to happen to them long term. Are they going to come off the oxygen, or the damage is going to continue to progress over time, and then down the road they're going to need transplant. So some of those questions really need to be answered right now, and we are closely following it. But I don't think this is going to be a one-off. Even at our center now, we are actively evaluating at least 5 patients who are in the same situation. So this is going to help some patients. I think it should not be considered as a first-line treatment, obviously, but in some patients who are extremely sick, we'll have to use this.
All right, Dr. Bharat, thank you so much for speaking to NDTV.